UroPatient. Tune in and see. Prepare your health for you and me. Knowledge is power. We make it clear every Saturday morning.
Hey, good morning, and welcome to the UroPatient podcast. I'm your host, Vic Senese. Welcome to the show. Hey, be sure to like and subscribe if you haven't already. Always a good idea. And today, could a simple urine test powered by artificial intelligence help detect bladder cancer earlier, faster, and more accurately? Well, let's find out. Hey, good morning, everyone. Today, we're discussing a major shift in how we detect and monitor bladder cancer. For decades, patients have relied on invasive procedures for surveillance. However, with the advent of the TOBY test and advanced artificial intelligence, we are moving towards a future where early cancer detection is painless, affordable, and accessible. Today, I'm going to explore the technology behind this AI urine test and how it fits into the evolving landscape of digital pathology. To understand why this AI test is so significant, we have to look at the burden of the disease. Bladder cancer is remarkably common, ranking 6th in the U.S., but its most challenging feature is its high recurrence rate. Because it often comes back, patients require constant long-term monitoring, which makes it one of the most expensive cancers for our healthcare system to manage. This creates a massive need for a more efficient way to keep patients safe. Now, the current gold standard for monitoring is the cystoscopy. If you've ever spoken to a patient about this, you know this is a procedure that they dread. It involves inserting a camera through the urethra. While effective, it is invasive, uncomfortable, and expensive. Our goal is to find an alternative that provides the same diagnostic confidence without the physical and financial toll on the patient. Enter the TOBY test, founded in 2023 and named after Sherlock Holmes' trusted bloodhound. I didn't even know that. This biotech startup has developed a way to smell cancer in a single urine sample. Doesn't use dogs, of course, but it uses the same principle, detecting the unique chemical signatures that cancer leaves behind. It's designed to catch disease at its most treatable stage without a single needle or clinic visit. The science here is called volatilomics. Every disease, including bladder cancer, changes your body's metabolism. These changes release specific molecules called volatile organic compounds, or VOCs, into your urine. The TOBY test captures these molecular signatures, which act as a real-time fingerprint of your health, often flagging the cancer long before a patient feels a single symptom. How does this technology actually work? It's a two-step process. First, the lab uses gas chromatography mass spectrometry to scan the urine sample and identify every chemical present. Then, the proprietary AI takes the massive, complex data set and looks for specific patterns associated with bladder cancer. In a matter of moments, it generates a real-time risk score that tells clinicians the likelihood of disease. Accuracy is everything in oncology. In internal validation studies, the TOBY test achieved an AUC of over 0.9 for bladder cancer, which is considered an excellent performance rating. What's even more exciting is that this isn't limited to just the bladder. The platform has shown similar high-level performance for prostate and kidney cancers, making it a potentially powerful multi-cancer screening tool. The FDA has recognized the potential and by granting the TOBY test breakthrough device designation. This isn't just a badge of honor, it means the FDA will work closely with developers to speed up the review process. This status is only for devices that show a reasonable expectation of being significantly better or less invasive than what we use today. This test is part of a larger trend where the pathologist becomes a diagnostic orchestrator. Instead of spending hours on routine manual counts, AI handles the heavy lifting of data synthesis. By 2030, we expect AI to automate the majority of routine tasks, allowing physicians to focus on complex, high-level clinical decisions, and integrating various data streams like this urine test with traditional histology. Deploying AI in a clinical setting must be done safely. We recommend the validated framework. This involves verifying the specific use case, performing local validation in shadow mode to compare AI against human experts, and ensuring that safety guardrails like confidence thresholds are in place so the AI supports rather than replaces human judgment. One of the most profound impacts of this AI test is its potential for health equity. Many patients in rural or underserved areas can't get to the specialist for a cystoscopy. Because this test only requires a simple urine sample that can be collected anywhere, it removes huge barriers to care, ensuring that no patient is left behind just because of where they live or their social economic status. Looking ahead, the TOBI test is just the beginning. The goal is a multi-cancer platform capable of screening for over 10 different types of cancer from the same single urine sample. If successful, this technology could address over 60% of cancer cases globally, making early detection a routine and effortless part of every patient's life. In conclusion, the combination of volatimics, boy, that's a rough word to say, and AI is poised to transform bladder cancer care. So we're moving away from the discomfort of that cystoscope. Most patients will be thankful for that, towards the simplicity of a simple urine test. With FDA breakthrough support and excellent validation scores, we are closer than ever to a future where cancer is caught early, treated easily, and managed affordably. Well, that's really great stuff to know that we're coming to this mixture between AI and science coming together, and hopefully it's going to mean a lot for everybody in the future. So keep tuning in to UroPatient to learn more. Have you ever finished urinating, zipped up, and then noticed a little dribble afterwards? You're not alone, and you're definitely not imagining it. It's called post-void dribbling, and it happens to millions of men and even some women. But there's the good news. Here's the good news. It's common, it's manageable, and in many cases, completely treatable. Next week on UroPatient, we'll break it down. What happens, what it says about your pelvic floor, when it's normal, when it's not, simple techniques you can start using right away. No embarrassment, no shame, just straight talk about your bladder health, because staying dry shouldn't be a guessing game. So, hey, join us next week to learn more about that particular subject. As always, got great subjects for you every week. So we'll see you all next week on UroPatient.
From research updates to daily advice, Vic explains it all, simple and precise. No question too small, no topic too wide. We're your urology partner, right by your side. UroPatient, tune in and see, baby, your health for you and me. Knowledge is power, power. We make it clear every Saturday morning. The podcast is here.